My name is Kara Zivin, and I am a research investigator at the Center for Clinical Management Research in Ann Arbor, Michigan, and I'm also an associate professor of psychiatry at the University of Michigan. Since coming to the VA, I think we really try to understand things like, adherence to medications, people's use of medications in terms of, are people getting the kind of care that they need for depression, or we think that is associated with what we know to be high quality care. My work is in mental health, specifically, typically focusing on depression. And I've done a number of studies trying to improve the quality of care, access to care, trying to understand what kinds of treatments patients are getting, and not only looking at their clinical outcomes, but also their functional outcomes, things like employment. A project that I've recently completed was we were looking at the impact of depression on mortality, as well as the impact of antidepressant use on mortality. So we know from a lot of things in the literature that depression increases the risk of death from chronic disease. There are not that many comprehensive data sources that are able to look at this, so to have patients both with and without depression over a period of time looking at mortality from all sorts of different causes. And so we found what you might expect, but that depression does increase risk of death from pretty much all major chronic diseases. But it was a comprehensive look at this that has not been shown in the same way in other data sources. A new study that I am working on is focused on how the VA responds to psychotropic medication warnings. And so we are looking at a few different medications, and we are working with the Pharmacy Benefits Management group to try to understand how their warnings are disseminated, how different VA centers respond to these warnings, and how does that change patient care? Are these medications reduced if there are some risks associated that have been documented? So that's a study that we've just gotten started in the last few months, and will hopefully have useful information, not just related to psychotropic medications, but other medications. It's really an organizational study of how does information flow, and what do people do with it, and how do they respond. Pharmacy Benefits Management has been a key partner in our new study focused on psychotropic medication warnings. We've talked with them and to try to understand how they receive a warning, what they do with it, how they process it, what their what their goals are, but they don't know what happens once the warning is distributed. So PBM will get a warning from the FDA, package it in materials, and then distribute it to a wide range of people within the VA, but they aren't able to know who receives it and what do they do with it and how do they respond. And they don't necessarily have the capacity to follow up to find that out. So we're hopeful that our research will help them understand ways that they could potentially improve how they communicate with various people within the VA to understand how these warnings are used and what needs to be changed, if there's something they can do to support people to implement them better. It really is a unique opportunity because it's the largest integrated healthcare system in the country, and VA is actually out in front in a lot of areas. For actually working in the VA and seeing the kind of data and processes, it's well advanced of a lot of areas outside VA, so I think that's also exciting as well.